Hello everyone. I am here to explain my topic efficacy of instrument assisted soft tissue mobilization in acute ankle sprain and functional instability. A systematic review. This systematic review explores the efficacy of IASTM in managing acute ankle sprain and functional instability. And here the abstract. Instrument assisted soft tissue mobilization has emerged as a promising technique in musculoskeletal rehabilitation, yet its efficacy in acute ankle sprain and functional instability remains unclear. This systematic review aims to evaluate the effectiveness of IASTM in improving pain, range of motion, and functional outcomes in individuals with acute ankle sprains. Methods. A systematic search of electronic databases which will be conducted to identify randomized controlled trials and clinical studies published in peer-reviewed journals. Studies will be included if they examine individuals aged 18 to 45 years with grade 1 or 2 acute ankle sprains and utilize IASTM as a primary intervention. The methodological quality of included studies will be assessed using appropriate risk of bias tools. Results. The findings will summarize the effectiveness of IASTM in comparison to conventional rehabilitation methods, highlighting its impact on recovery, pain relief, and functional outcomes. Conclusion. This review will provide insights into the clinical utility of IASTM in managing acute ankle sprains and functional instability, potentially guiding physiotherapists in evidence based practice. Future research directions and limitations will also be discussed. Introduction. Ankle sprains are among the most common musculoskeletal injuries in both clinical and athletic settings. They occur due to excessive inversion or eversion of the foot, leading to ligamentous damage, pain, swelling, and reduced range of motion. These injuries are particularly prevalent in sports such as basketball, soccer, volleyball, and running, where sudden directional changes or missteps increase the risk of ankle instability. Among the different types of ankle sprain, lateral ligament injuries account for approximately 85% of cases, with the anterior talofibular ligament being the most frequently affected. This is due to its limited ability to resist inversion forces during plantar flexion, making it vulnerable to overstretching and tearing. The incidence of ankle sprains is high, with the studies indicating that approximately 23% of individuals in the general population will experience an ankle sprain at least once in their lifetime. However, this percentage is significantly higher among athletes. Instrument assisted soft tissue mobilization is a manual therapy technique using specialized tools to apply mechanical pressure on soft tissues. It is designed to break down scar tissue, improve tissue mobility, and stimulate fibroblast activity, enhancing recovery outcomes. Mechanical effect. The applied pressure facilitates the breakdown of dense, disorganized scar tissue and encourages proper fiber alignment in healing ligaments. It enhances joint mobility and soft tissue extensibility, helping restore range of motion. Physiological effects. IASTM increases local blood flow and fibroblast activation, which are crucial for tissue regeneration. It stimulates mechanoreceptors, improving proprioceptive feedback, which is often impaired after an ankle sprain. Mechanical Rationally, effect. The ankle sprains involve soft tissue damage. IASTM may be beneficial in addressing tissue dysfunction and improving rehabilitation outcomes. healing ligaments. The research gap. It enhances most existing studies on IASTM focus on chronic conditions, with limited research on its effects in acute ankle sprains. Physiological effects. Objective to assess the efficacy of IASTM in reducing pain, improving range of motion, and enhancing functional recovery. It stimulates mechanoreceptors, improving proprioceptive feedback, which is often impaired after an ankle sprain. Inclusion criteria. Population. Individuals aged 18 to 45 years with grade 1 and 2 acute ankle sprain. Intervention. IASTM applied alone or with conventional physiotherapy. Comparison. Traditional treatments, exercise or no treatment. Outcomes, pain reduction, range of motion improvement, and functional recovery. Physiological effects. IASTM increases local blood flow and fibroblast activation, which are crucial for tissue regeneration. Study selection and data extraction. Prisma flow diagram was used to illustrate study selection. Key extracted data included study design, sample size, intervention details, outcome measures, and adverse effects. Mechanical effect. The applied pressure facilitates the breakdown of dense, disorganized scar tissue and encourages proper fiber here the Prisma flowchart. I identified and screened about 189 articles, and finally I included about only 6 full text articles. IASTM increases local blood flow and fibroblast activation, which are crucial for tissue regeneration. It stimulates mechanoreceptors, improving quality assessment. The Petro scale was used to assess study quality based on randomization, blinding, follow-up, and statistical reporting. Mechanical effect. The applied pressure facilitates Petro scores for my studies. Here I selected 6 studies. For the first study, it scored about 8 for 10, second study 4 for 10, third study 10 for 10, fourth study 4 for 10, fifth study 10 for 10, sixth study 10 for 10. It stimulates mechanoreceptors, improving proprioceptive feedback. And here the forest plot findings after an ankle sprain. The pooled effect size coherence D, which is about 0.48, 95% of CI, which suggests the moderate benefits of IASTM in pain relief, range of motion and functional improvement, and encourages proper fiber alignment in healing ligaments. It enhances joint mobility and soft tissue extensibility. Results. A total of 6 randomized controlled trials involving 320 participants. The sample sizes ranged from 30 to 75 participants. Pain reduction. Significant decrease in pain with IASTM compared to controls. Range of motion. Improved ankle mobility post IASTM treatment. Functional outcomes. Enhanced balance, proprioception, and mobility scores. Swelling reduction. Some studies reported decreased edema with IASTM. Muscle activation. Improved neuromuscular control and strength. Short-term effectiveness. Benefits observed within 2 to 6 weeks, but long-term effects remain unclear. Range of motion. Physiological effects. IASTM increases local blood flow. Discussion. Effectiveness of IASTM. Pain reduction. All studies reported significant pain relief. Range of motion improvement. IASTM consistently improved dorsiflexion and plantar flexion. Functional recovery. Faster return to activities in IASTM groups compared to traditional care. The applied pressure facilitates the breakdown of dense, disorganized scar tissue and encourages proper fiber breakdown of scar tissue and facial adhesions. It enhances increased fibroblast activity and collagen synthesis, enhanced blood circulation and lymphatic drainage, neuromodulatory effects improving proprioception. Local blood flow and fibroblast activation, which are crucial for tissue regeneration. It stimulates limitations and future research directions. Small sample sizes in included studies, variability in treatment protocols, that is IASTM duration and pressure, lack of long-term follow-up studies on Re-injury prevention. Future trials should standardize IASTM application and evaluate long-term effects. Dense, disorganized scar tissue and encourages proper fiber alignment in healing clinical ligaments. Implications. It enhances IASTM should be considered as an adjunct therapy for acute ankle sprain rehabilitation. It helps address soft tissue dysfunction, enhances range of motion, and prevents chronic instability. Athletes and physically active individuals may benefit from faster recovery to sports. Proprioceptive feedback, which is often impaired after an ankle sprain. Conclusion. IASTM is effective in pain reduction, range of motion improvement, and functional recovery in acute ankle sprain. This systematic review examined the efficacy of instrument-assisted soft tissue mobilization in the management of acute ankle sprain and functional instability. Based on the included studies, IASTM demonstrates potential benefits in reducing pain, improving range of motion, and enhancing functional recovery when incorporated into rehabilitation protocols. The findings suggest that IASTM may be an effective adjunct to conventional physiotherapy interventions in managing grade 1 and grade 2 acute ankle sprain in individuals aged 18 to 45 years. Mechanical effect. The applied pressure thank you all for your attention and for listening to my presentation. And encourages proper fiber alignment in healing ligaments.